Ethics of Compensating Community Partners. We are recording this session since a number of people were unable to join us today during this time. So my name is Laurel Hirt, and I'm the director of the Center for Community Engaged Learning. And my colleagues will also, I think, introduce themselves as they start presenting their sections. So my task today is to share with you thank you, Laurie. Our kind of overall framing for this topic and how it has come about and how the University of Minnesota has been part of a national conversation on compensating community partners. So in the late 20 teens, a number of us across campus were part of a group called the Community or Cultural Knowledge Holders Committee, and we presented a report to a variety of sources, including the Office for Public Engagement, that made a series of recommendations around the challenges of compensating our partners here at the University of Minnesota. This looked at both the teaching and learning mission of the institution, as well as the research and discovery aspect of our institutional mission, and identified a variety of barriers and just a lot of inconsistencies. So that work has continued in different ways throughout the last couple of years. We also did a survey back in 2022 initially that asked faculty and staff about their experience trying to compensate partners for things within both, once again, that teaching and learning realm, as well as the research and discovery realm. Laurie has redone that survey and will be reporting on the current situation in a little bit here. Back in 2023, the Office for Public Engagement, along with Morrill Hall Shared Services and our purchasing office, collaborated to develop a very short resource that exists, and Laurie will be sharing more fully coming up here, about all the different ways that the institution, people within the institution can compensate, and some of the kind of hidden things that not a lot of us know. So that will be coming. My role here at the university has really been with a lot of our teaching and learning mission and working with community engaged learning courses. Through that, I've been part of a national network called the TRUCN, the Research University Civic Engagement Network, which is part of Campus Compact, a professional organization that higher ed institutions across the country belong to. And we took our initial survey and started talking about this topic much more broadly at the national level. We decided to expand on our survey and sent out a survey to our national networks through higher ed, R1s, as well as all different types of colleges and universities. That work ended up with us presenting last year at a national conference, and it was by far the most popular session at the entire conference, indicating to me this is a topic that we all need to work on, and none of us have figured out how to best do this. So that work has continued. We are working to develop a toolkit that is going to exist on Campus Compact's website, and so that hopefully will be released this summer. And there are some exciting avenues that are happening across the country at other R1 institutions to support folks in doing this. But Laurie, take it away.
Thanks, Laurel, and welcome everybody. Good morning. Great to see you. So many familiar names, and maybe some new folks to our networks. We, oops, what is that? Oh, hang on, just jumping ahead. Okay. Um, so as Laurel said, this institution has really been a leader in many ways in thinking about this, in particular Laurel, at both the local and the national level. And a survey was done by Laurel's group in 2022, but it was really focused on the community engaged learning community and wasn't really targeting community engaged researchers or those who are doing a lot of service, outreach, practice. I've been here for I'm sorry, I'm the Vice Provost for Public Engagement. I've been here for a little bit over a year, and we have a Public Engagement Council, which is a set of leaders who come together regularly to talk about issues, especially administrative issues, that are barriers for our engaged faculty and staff and students. And so before I got here, as Laurel said, a document called Options for Compensating Community Partners was created. I'm going to show that to you, but I wanted to get a sense of, was it being used? Were people aware of it? And also to get input about compensating partners, not only from the community engaged learning side of things, but also community engaged researchers and really anybody who has partners that they might want to be working with and compensate. So last month we did a survey. Some of you probably completed it. Thank you. And we had two parts to it. One part was about compensating community partners. The other was for community engaged researchers who are submitting to IRB. And so here we're just presenting the piece around compensating community partners because we know this is fundamentally an ethical issue, right? To make sure that our partners are recognized and compensated for the work that they're doing, and we're not simply coming in and using their labor when appropriate. So we conducted this survey last month. The people it was sent to were folks who are in our public engagement network, which is our network of centers and institutes that have an engagement mission or component to their work. Our Engaged Scholar Directory, which is a website on the Office for Public Engagement website of engaged scholars. And we know it's outdated. We need to update it, but it has many people in it. And then anybody who is listed as a contact in the public engagement footprint, which is the map of engaged activities as best we can collect them around the institution. And we knew that a lot of those would not be relevant. They're not really doing the kinds of work. They're working in communities and with partners, but maybe not in the ways that would be relevant for this. So we knew it was an oversampling. And then we had a bunch of bounces, of course, but we got 204 responses. And I thought that was great, given that I knew that many of the footprint people were not going to be relevant for this. So we got a 20% response rate. I just think that's huge and really speaks to the need for people to want to contribute to this conversation. And of those 204 responses, 187 reported collaborating with community partners. And so you see here that we had majority were staff, and that's a big category of P&A and civil service and extension and folks. And then, 43% were faculty. People could choose more than one option. So, he had some faculty administrators or staff administrators. And most were from the Twin Cities campus, but we got a decent showing from the other campuses as well. So that's sort of who we're worked with, and then kind of the scope of what they're responsible for. So the first thing that we asked about was just what are the types of collaboration that you do? And this was a checklist, and people could pick as many as they wanted to. And you see that the most common thing that people are working with community partners around is guest speakers or panelists, which makes perfect sense, right? It's a time limited kind of thing. It's not too big of a burden on a partner. And it's easy to slot in many ways. And then we also have about half of our groups talked about advisory committees. But look at this, we have 46% of them who have co-presenting at a conference. I think that's pretty amazing in terms of really good engagement practice, right? We want to have our partners be co-presenters with us. Many are serving as sites, et cetera, et cetera. And this kind of boils down into Things that are general, like guest speakers and panelists and advisory committees. You're going to do that with research. You might do that with education. You could do that with outreach events. There's a set of things that are around research, co-authoring, being a co-PI, being a research team member. And then we have things around student education and support. So co-teaching or site supervision or being a mentor, leading small group discussions, etc., developing curricula. And then we have one here near the bottom called programming. And I will tell you that we didn't simply have programming in this list. So this comes out of the other responses where people could put in an open-ended response. And so 9% said programming, but I would bet that this is incredibly underrepresented and that there are many, many more uh, um, types of collaboration that are really just about delivering or offering programming. So just wanted to note that that was something that we just didn't have in there. And so next time we do this, we'll have it in. We also then asked, what types of compensation do you do? Now, I want to say right up front here that compensation is not necessarily always appropriate, required, or necessary. And that's actually a discussion that is really interesting about what are the criteria? When is it appropriate? When is it necessary and respectful to do that? And when is it maybe not something that needs to be considered as much? But when we said types of compensation, this is not all compensation, right? Some of this is more categorized, maybe as incentives or just sort of gifts to give back, respect. So compensation I think of as more like money, right? We're giving you money or we're buying out. But the number one thing that people do is food and meals, and that makes perfect sense. It brings a sense of community. It's financially more feasible. Parking passes or paying for parking. And then we get into conference fees and travel. And so that's a pretty common way. About a third of our respondents said that they do that. I think when this was originally developed too, we were looking for specific ways and methods that people provide. I'm going to call it compensation again with the caveat that I said. So gift cards, debit cards, etc. But what I found was that down here, near about a third from the bottom, people just said we also do. This was in the open-ended responses. We do honoraria. Well, the way that you would do honoraria is going to be sometimes through gift cards and sometimes through debit cards, but it might be through a check. And so that's another thing we didn't capture in the check boxes. And I'm sure that honoraria is under captured here because it is going to overlap with some of these other things. So the other thing is that some people in the other responses said, well, we provide services. And so maybe we don't compensate with money, but we're creating services that are beneficial. And that's absolutely true. And another thing that's overlooked and underreported here. So you can see here, and we're happy to send out this. I think we're happy to send out the slides. Yeah, we're happy to send out the slides, and there will also be a recording. And so these are the kinds of things that we found. So then we asked in an open-ended question about barriers to compensation. Just what do you run into? What are things that get in the way? And I want to say that majority of our people had something to say. And so we know that there are many barriers. One of them is funding constraints and inconsistent budgets. And for me, working with our public engagement council, that's not a thing that I have a lot of control over, right? That's not something that we can push. But we are looking for, but we can send that message, and that's certainly true. But we're also looking especially for bureaucratic things. So these other areas here are very helpful for our office to go and talk with people to say, are there ways to facilitate this? And that's how that Options for Compensating Partners document was first created. So what we find is that there are lots of bureaucratic hurdles and complex approvals, and I have there's a report that I've created out of this work, and it's much more specific about what some of these are. So these are the big categories. We just don't have time to go into the details right now, but that payments are delayed, that policies are unclear, or maybe people don't know what they are, and you get wrong information or you get inconsistent information about how to compensate. And then we have limited flexible payment methods. And we know that there are things like you're working with undocumented communities and they don't want to, they don't have some of the stuff that we have to have, or people have to register as a vendor to get paid, or whatever it is, right? They're very difficult. And we know that's difficult inside the university, right? So are there ways that we can think about this with external partners? And then one question that I had was, is this at different levels? Like, is this a departmental issue? Is it a college level issue? Is it really university wide? And really, you find these at all levels. At the university level, it's really about trying to have a single way to do things, or at least a perception that there is. And then in the departmental and college level, a lot of it is around not knowing. You don't have a dedicated or a person who's sort of assigned to deal with external partners. They may not know, honey, honey, I got coffee grinding going on. I don't know if you can hear it. If you can't, great. Okay. Just hear me yelling, honey. So you have different kinds of policy differences and so forth. And we can see this in these more specific discussions that people gave. So, but we wanted to think about that because at the university level, our approach might be different than working with colleges and departments. We also asked for people about what worked. And some of these are cultural, like recognizing expertise and thinking about equitable pay. But some of it is more about what can we do? Well, some places have been successful, I think, in streamlining administrative processes or sharing information about flexible payment options, making sure that compensation is integrated into grants and MOAs. And that's a thing, if you're a faculty member who's doing community partnership work for the first time, it might not be obvious to build that into your grant or what the right amounts are. Building supportive relationships with finance staff, that's so key, right? You always have to have your administrative people on board with you. I think this is a big one that we can really do something about, is training finance staff and university personnel about what the options are. And then there were many suggestions about establishing compensation standards. So that was great because we also asked in the survey, what is reasonable compensation? Knowing that this is a very, very complex question. There's no single answer. So we sort of said, what would you pay for what kind of work? Just describe what it would be. And we sort of got a range here. So as a guest speaker, people talked about, and we didn't say here, what would you pay for a guest speaker? What would you, this was totally open-ended. And so we got a 50 to 300 per session, which is a wide range. I'll tell you that I think a lot of people landed in the $100 to $200 range, 100, 150. For advisory board members, of course, that's going to depend on how frequently they're asked to do things and what the scope of that advisory board work is, but it ranged from $75 to $1,000 a year. I think it mostly came out in the 500 to 1,000 area. Working on program development and research, again, very specific to the program or research. A lot of that was more like buying out time, buying out staff time, or paying something to an agency. And so it was really a negotiation with them. Participating in an event, it was more like 150 for, there was actually some very specific things, like it kind of boiled down to $100 for an hour, $300, $500 for a half day, $1,000 or $1,500 for a full day, where they're actually like a key part of presenting and guiding, et cetera. So again, depends. Consulting and mentoring, et cetera. And then additional considerations like having travel reimbursement or meals. But again, I have more specifics around this. I just wanted to give you an overall sense in this. The last thing I wanted to mention is this compensation options for community partners document. So this is what came out of the previous work. The Office for Public Engagement and probably Laurel's office worked with purchasing at Laurel Hall Shared Services Team, which is our finance folks, and purchasing services to create a grid that has different ways that one can actually logistically pay a partner, give money to a partner. So this is just the first part of it. There's checks, there's gift cards, there's debit cards, and I believe, can't remember if what the last one is, subawards maybe? I'd have to look, but it's a document and the link is down here. It's in our Office for Public Engagement, M-Engage websites, partnership toolbox under financial. Um, and so it's useful for what it is, right? It says, here's what you use it for. Here's the amount that can be done through this way. Here's the possibilities and the risks. So it's very logistical. And in the survey, I asked, did you use this and was it helpful? Did you use it and it wasn't helpful? Have you not used it? And then asked about that. And so people said who had used it said, yeah, it was helpful. They said both. They said it was helpful or it wasn't helpful, but the vast majority of responses were, we never heard of this thing, right? And so that's great information for my office to say, okay, this is also probably relevant to everything else in our partnership toolbox. We need to be putting these things out in front of people regularly so that they are aware of them, because you don't really remember they exist until you need them, right? And at that point, you don't remember it exists. So that's great information. So my hope is going forward, that this was a great resource, but that we want to go forward with these recommendations that you have on other things, because still, clearly, this is not sufficient. This is helpful, but not sufficient for partners. And so we'll go forward and work on training and work on maybe recommendations or suggestions for guidelines. No hard guidelines, but here's what you might think about when you're thinking about compensating partners. As well as maybe some guidance on when it is appropriate or not appropriate, because there are many people who don't compensate partners, but then they also put in a response that said, yeah, but we provide services or we do these things. And so they, again, aren't seeing that as compensation, but it's part of the partnership. So I think I'll stop there. I'm going to stop sharing so that Angie can control her own slides. I don't know. Do we want to take any questions real quick, or do we want to just go forward and we can do questions later if there are any? What do you think?
Yeah, let's see if there's any questions before we move on.
Are there any questions? Oh, Susanna.
Hi, thank you all so much for doing this. I am delighted that this is happening. And I just have a quick question about the crowdsourced funding amounts. Do you have a sense, I know this is just taking in information and we'll see where it goes. Do you have a sense of how many of those opportunities are sort of classified as almost professional services? And I'll tell you why I'm asking. We have a community advocates program that we benchmarked against several other cancer centers that, we're really taking community experience and expertise as a form of expertise, right? Which is a nuance of like, a lot of people on this call probably do similar things and different things, right? In compensating community partners. So I'm just wondering, sort of on the spectrum of like, this person is a consultant because they are a community member with lived experience versus this person is participating in something, but we're not necessarily like asking them for their knowledge or input. Do you know what I mean? Just
I
curious.
do, but what is the question in terms of what are the criteria there for whether you would or would not compensate them?
Just if you had any information from the survey about the range of that experience.
I'll have to dive in. I think probably not. I think that's not where people thought, but that issue is really interesting. I think Angie's going to deal with some of that as she talks. So let's go ahead and thank you, Susanna. It's good to see you too. Angie, do you want to go ahead?
Thank you. It sounds great. While I'm doing that, Laurie, if you can also give me co-host privileges so I can open up the break rooms for the end. Well, welcome everyone. Good morning. Again, my name is Angelica Koch. You can call me Angie. I am the Assistant Director for CEARCH, Community Engagement to Advance Research and Community Health. And we'll talk a little bit more about that in a minute. But I do want to just have you all think about what we've just heard and all the data that has been shared with us and help us ground a bit on our discussion that we're going to be moving into next. And so if you could just humor me with going to menti.com and putting in that code 7337-8209 or using the QR code, I would like to understand where you are at. What are your guiding principles for yourself as an individual as you are thinking about equitable compensation, or you as a representative of your organization. This is going to be a cloud, so let's, short phrases would be ideal here, but if we could just get a sense for where we're all at, that would really help. So guiding principles, we've got respect, we've got diversity, inclusivity, transparency, trust. These are all great. Fairness, honor, mutual benefit, community-centeredness, expertise, appreciation. Excellent, excellent. These are all great guiding principles for ourselves to really help center as we think about how we're going to move forward and take the next steps and move towards institutional change, move towards organizational change as we're looking at how we're framing our next steps with equitable compensation models. Awesome, thank you so much. So what we're going to see now is how that relates to the section that I will be speaking on. I'm just going to share my slides here. Thank you for doing that. I really appreciate it. So let's just remind ourselves why we're here. And I took this quote. There's a resource that was created on behalf of the Urban Institute, and it hit home, and it's really why we're here. Within participatory work, we must remember that we are engaging with individuals as colleagues and partners, but not as research subjects, constituents, or program participants. So paying people for their time is not an incentive, it's compensation for their expertise. That last part is so pivotal and foundational to the work we're doing here today, is remembering that we are compensating for their expertise. And compensation, as we heard from Laurie, comes in many different ways. So some guiding principles that I'd like to just share with us here is, I'm gonna just hide my, there we go. Okay, some guiding principles. So authenticity and transparency, very much in line with what you all shared earlier. So ensuring that we're coming to the table as we're working through our relationships with individuals, we're bringing our whole selves. We are coming with an authentic approach to how we communicate and frame our conversations and our relationship. And we're being transparent. What we know, what we don't know. What hats are we wearing and which hats are we not? The fact that we're representing, we are speaking on behalf of an institution and an organization, and just putting all of our cards on the table so that then leads to trust. And so by doing so, we're going to be able to dig deeper into the conversations when money or compensation comes into play. The next guiding principle that has been very important for us has been bidirectional learning and sharing. Here it's the why. Why is this important? Why are we here? Why are you coming to the table and why am I coming to the table? Why are we sharing resources and expertise? Really understanding your partner's why and your why, and ensuring that they are aligned. If there are any barriers, any areas that hit against each other, really working through that, because that's going to lead us into more robust, again, transparent, authentic conversations. Compensation should be reflective of the expertise and knowledge that we are asking of our partners, right? So thinking about who you are asking to partner with on a particular project. And if you were in their shoes, flipping the tables here and thinking about the expertise that you're asking of, how are you going to ensure an equitable compensation framework? You understanding the importance of an academic versus a non-academic level of experience and knowledge base, and ensuring we have balances on both sides. And last but not least, flexibility. So we work within an institution. We work with our own red tape when it comes to compensation, understanding that just as we have challenges and barriers, so do our partners. And so how are we going to remain nimble during that process? Alrighty. So I want to just step back. I'm not sure where my, I apologize. I'm not sure where the additional slide is here, but what I would like to just share is that these guiding principles are key to the work that CEARCH does. So again, CEARCH is I'm privileged and honored to be leading a group of experts within CEARCH, and to have the privilege to work with community as part of our day-to-day work is so important to also being able to bring voice to their expertise. And so these guiding principles, as we as a CEARCH team are out there and partnering with our community members, recognizing that we have to constantly be framed and founded in these principles. And by doing so, we are able then to achieve ultimate success. And here are some just some straightforward steps for success that have really allowed CEARCH and other experts across the U be successful in their areas of compensation conversations. First and foremost is building that relationship. If there's anything you're going to hear from me today at the end of this conversation, is relationship is foundational. We must ensure that relationship is part of the outcome and that this is not a transactional approach. And in order to do that, we need to have that trust as a base. So once we are able to do so, then we're able to move into frequent and ongoing conversations. We know as human beings that we need to communicate. We need to be able to have back and forth conversations with one another to really dig into the why. And so I want to emphasize that I know this is so basic, if you will, right? But this is probably where things easily break down. Having been in local community work, having built a free medical clinic, to working up at the Minnesota Department of Health, communication is always the first thing to break in all areas. And so if we can just truly own it and live it and breathe it, I promise it will be a smooth sailing. You're still going to have some issues, but it'll be smoother sailing experience. But the part that I want to point out here is the time sensitivity. Conversations need to be mindful of time. And so what I mean by that is having conversations early in the process. You're reaching out to a partner, you're talking about connecting and being together on this particular project. Start talking early about expectations regarding compensation and understand that their timetable is different than our timetable, right? A great example for this is in a previous role, my organization was a pass-through for funding. And so we had another organization provide funding for the work that we were doing with community. Well, our funder was not pushing funding down quickly enough to us, and we did not have a backup system. There was no redundancy to be able to pay our community partners. Some community partners were able to sustain the work we were doing together because they had contingency plans. And I had two partners that couldn't. And so they ceased operations. They could no longer move forward. And that was a detriment to the work that we were trying to achieve, not only operationally and programmatically, but relationally with our partners. So time is extremely important here. I would also say that the next piece is understanding what's worked well for your community partners. You know, they have been in this world of sharing their information. They understand that they are an expert in their area, in their community. Ask the questions, how do you see compensation work best for you, given your experience? And, it'll range anywhere from stipends to contracts to maybe more like in kind or resource sharing. Sky's the limit here. But the key point that I want to make out here is whether it's formal or informal. Do they need to have this agreement in writing? Do they need to put it in black and white and say, this is how we're going to be compensated? Or is it more of a handshake or a verbal agreement? All those important pieces need to be part of these conversations sooner than later, so that as we move forward into our relationship, then we're able to not have to worry about those details. And then the last piece for success that has again been a best practice in all of our work, those of us that are working, those of you that are working in community engaged initiatives, is the co-development of roles and responsibilities. What is being paid for and what isn't? What are we agreeing to and what are we not agreeing to? What are our timelines? What are our milestones? What are we aiming to achieve? What are my expectations as the payer for the particular partner that I'm working with, and what are their expectations of me in regards to compensation? So ensuring that that is all clear and that we're not bringing in our own assumptions. So in order to really achieve some basic key successes, it's also important to then be prepared. And so what I'd like to share here is just 4 key components that have really served well in how to be prepared. And that is understanding where you're coming from, what hat you're wearing. So by doing so, I have an understanding institutionally of what I can control and what I can't control. I'm new to the U. I've been here 11 months. I've worked in state health departments. I know finance politics. I understand institutional red tape. And so it's no different in a big institute like the U. So understanding where my easier paths, least resistant approaches versus my uphill battles, right? The other component is understanding what am I coming to the table with financially? What is my preliminary budget? Do I have a preliminary budget? And if I don't, asking myself why I don't have a preliminary budget. But when you do, keeping an open mind, understanding that that number you're writing is not set in stone, and being able to be nimble about it. I understand with grant funds in particular, because that's the world that we live in, that's the bucket we have. So what are your contingencies around that? How are you going to maintain a nimble approach during your conversations if you've created this program and this budget after having your conversations with the partners? So part of that flexibility needs to be there, being outside of the box thinkers. So, just thinking about what are opportunities that we can add to the current pot of funds, but yet still be applicable across the board. And overall, ensuring an equitable approach is being followed. So what you're doing with one partner, you're really mimicking that with all of the other partners, and you're constantly doing process improvement. I will also say that it's important to understand that you have a grasp of your finance process. So we've talked at length about that. But more importantly, making sure that your finance departments, your administrative staff, as Laurie mentioned, that they are aware of not only that this is happening, but that this is important work, right? That this engaged work is is key to the success of your programs. And then, of course, as I mentioned, timeliness, ensuring your finance department understands what times you're working with and where there's wiggle room and where there isn't. And the last is a constant check to ourselves. What assumptions am I bringing? Laurie mentioned that we didn't capture as much of the data around non-financial compensation approaches. So am I assuming that my project, that the community partner is going to be just fine with being a part of this program and being able to publish work and knowing that they're doing great things to their community? Yes to all of it, but they also have to pay bills and they have to put food on the table and they have to provide support and resources to their community. So making sure that we are keeping in check of our own assumptions and being mindful of what the community truly needs. So with that, I wanted to share a little bit about what CEARCH does in regards to approaching its compensation work. And all of our work is really grounded in our mission and values. The importance of bidirectionality, the importance of authentic and transparent relationships, the importance of knowledge and trust building, health equity, sharing research results, etc. All this is the guiding principles, if you will, the values that we move forward in all decisions that we make. And so because of that, when I came into this position, I needed to better understand, well, who are we paying and how are we paying them and what's the thought process we went through? And so for CEARCH, at this moment in time, currently, we pay for grant application reviewers. So we have grant apps throughout the year. We pay community members and staff, eligible staff, to review them. We pay our management council members. They are the glue to the work that we do, and they are they help represent the community voices to the work that we produce and engage in. And so we pay them, we pay consultants, trainers, and then I put in here our chat sessions. This is a very programmatic aspect. These are community health authentic talks. And we invite community partners to come into a panel around some research questions based on the topic. And they share their lived experience. They share their expertise in that particular arena, and we pay for that. So just to show you the thought process we initially took with our grant reviewers, our grant application reviewers. So community members, we knew across the board they were going to be eligible to receive funding, and because we're asking of their time and expertise. Staff, it really depended on the staff that we're asking. Is this normally part of their day job? Is their supervisor approving that they get paid above and beyond their normal work? So that's that arena. And then faculty, for grant application reviewers, we felt that this is really for us in academia, the importance of giving back to our community and sharing of our expertise. But there are exceptions to this rule. Community members may not always want to get paid financially. They may want something different. And so really, again, understanding what it is, their why and the how they want to get compensated. And then for faculty, we do pay faculty if they are leading a particular program or initiative on behalf of CEARCH, and they're in their developing, designing, implementing, evaluating, etc. So again, there are exceptions that we take into consideration. You'll find that it is not black and white, but part of our constant is that we're always going back to our guiding principles. Alrighty, I'm just gonna give quick examples. You'll have access to these slides. Wanted to show you the gamut of how we compensate. On average, we try to stay within the $75 to $100 hourly rate, depending on the scope of work that's being done. So we talked about chat sessions, we talked about grant reviewers. We have community partners coming to co-facilitate, co-educate with an academic partner on a particular topic. And so they're actually developing and designing those trainings. Same with our community-based participatory research course that we're hosting in collaboration with the School of Public Health and providing those honorariums for them. We talked about council members. And so what I would like to just share is, as I mentioned, I'm constantly working with the team on what skills are needed for compensation, what is the level of responsibility that we're asking of them, how are we equivalent to some degree aligned with our current pay structure, staying within that hourly range, and then most importantly, remaining flexible. I just had a scenario where it wasn't a clean and cut dry situation. And so we really needed to think about how do we align with our current process? And then how do we remain flexible to meet their requests and their needs, knowing that it was a bit above our budget? All right, a few more slides here. We've talked a lot about these tidbits of successes, knowing your financial practices, being in constant communication. We are part of CTSI, Clinical Translational Science Institute, and we have an amazing admin and finance team who understands the important work that we do with community engagement practices. And so they're working with us to ensure that we are able to effectively and efficiently pay our partners. Constant team approach to conversations. My director, Dr. Michelle Allen, are not working in a silo, in a bubble, but rather we are having conversations with our team members who are direct connections to the community to ensure that we are thinking about all aspects of what's in front of us. And currently, we are really focusing only on the 1099 and gift cards. We do a lot of gift cards, especially with our chat sessions. And then we are able to do contractors. I know that sometimes 1099s don't work. Having run a free medical clinic, I know that there are going to be sometimes some legal issues that you need to work around. Understanding, again, the system that you're working within. Okay. All right. So, Laurie, I was thinking maybe 8 minutes for a small group, or do you want to?
Sure. Laurel, I think you were going to lead the small group piece. Is that right?
Sure. Yes, so we're going to ask folks, we're going to assign you into small groups and ask you to share on the slide. Do we have those that we can share?
Yes, I am. You
Okay.
should see it now, but I'm working on the.
Okay.
I'm going to put it in the chat for everybody.
All right. Yes. So what are the immediate action steps that you can take today to think about how you are doing your work within your unit and or within the institution? What do you, I think we're open certainly to hearing what are the larger things that we need to be thinking about as well. So Angie is going to assign folks to breakout rooms, and then we will give you, maybe it's now like 6 minutes?
6 minutes. Perfect. I was just thinking the same thing. All right.
And Laurie is going to, then we'll do a brief debrief, and then Laurie will go from there. So.
All right, here we go. All right, so Laurie and Laurel, I just kept us in here, but you're welcome to join a room.
Right.
And I'm gonna make sure that I can allow people to do that.
Okay.
Okay, so you can hop into, if you go to breakouts.
No, I'm good. I'm going to let them do it. I think Laurel got assigned.
Yeah, I can bring her out.
No, I mean, that's fine. She can either way. Yeah. So we lost like 15 people immediately as soon as we said we were doing small groups. So in the future, I'm wondering, is it always necessary, right? So, but
Yeah.
just for us to think about something, but I think your presentation was great. And we still have, a bunch of people who are in and interested in engaging.
Yep, absolutely.
I have to figure out how to share the recording though, because, we didn't have registration, so we don't really have a list.
Yes.
Oh, there you are, Laurel. Okay, you want to do the share out? You're muted.
Sorry, there, I'm unmuted. Yes, so our group didn't have a lot of answers here, but we had some more ethical conversations and questions about how do you determine and how do you even know when you're actually going to be using the knowledge that you're wanting to compensate for, as well as just some inconsistencies across different partners. So I'm curious, is there a group that had a great, what's your next step that they would be like willing to even put in the chat as what is your next step? Maybe that will.
Or speak up. You can put it in the chat or speak up.
Or speak up, yes. So anyone had any wonderful earth-shattering ideas or non-earth-shattering ideas?
So we talked about, Susanna raised, I think it's not a new idea, but I think it's continuing some of our conversations around benchmarking. Like at least within kind of the academic health center space, so that we can have, when people come to us and say, how much should I pay a community advisory board member? So we have a good answer that's based on not just CEARCH experience or the program and health disparities research, but we can say, this is what we think is equitable. And we've talked to some of our community partners about it and they sort of agree. And that we're all like, if community partners are on, projects or advisory boards across different units, that they're seeing similar expectations. So I think moving forward, that work is super important.
That would be fabulous to share more broadly than just the University of Minnesota as well. I know people would appreciate that. So thank you, Michelle. Jamie says, my first action step is related to that document, our target per hour rates and overall rates for specific tasks like the table shared today. Reaching out to confirm when payment is received. Yes, that is an excellent good thing. That does a long way in building relationships. Yes. Anyone else have anything?
I'm going to interrupt, Laurel, because we're at 1 minute.
Okay.
And so I just want to wind us up, although you are certainly welcome to send any ideas or input to any of us. Thank you so much for attending. Our next steps, at least my next steps, are that the Public Engagement Council will meet in April, and I will be presenting this report and data to them and talking about next steps, which will be probably focused, I would think, on the training aspect, the communications aspect, identifying some kind of guidelines for compensation rates, having discussions with purchasing and the operations side. That one's a little more challenging and takes some time, but we'll give it a go. And then keeping you all informed. And we'll send out the slides and we will send out yes, exactly. We will send out the recording, and please share it with anybody. We don't have a registration list, so I'm just going to share it in our newsletters. So for anybody who wasn't able to attend, but feel free to forward that information. Any last comments from my colleagues?
Thank you for coming today.
Thank you for being here.
Yeah, have a good weekend. Thank you so much.
Bye-bye.